Hi everyone, this is Dr. Rajini, Gynecologist, Laparoscopic Surgeon from Care Hospital, Banjara Hills. Today we are going to talk about high risk pregnancy. Every pregnancy is precious, but there are few pregnancies where they are termed high risk. What is this high risk pregnancy? So any pregnancy which causes disturbances or which causes risk to the health or life of mother and its baby and her baby is called high risk pregnancy. In high risk pregnancies, there is a need to take extra care of mother and baby, and there is a need of lot of extra investigations, and there is a need of technology or equipment, higher end treatment is needed for such high risk pregnancies. So talking about the risk factors, who are at risk of these high risk pregnancies? Sometimes what happens is a patient can be normal during initial days of pregnancy and suddenly she can go into high risk, or the women might be having high risk factors or high risk issues from the beginning and she can get pregnant and it is a high risk pregnancy. So certain risk factors which affect women going into his high risk pregnancies are women who get pregnant at a very younger age, or an elderly woman, those who get pregnant after 35 years or so. In the current scenarios, we see women getting married because of the career issues or all. They get a lot of late marriages these days. So all those women who are 35 plus, definitely they go into a high risk pregnancy group. So some women may be having medical disorders even before pregnancy, like diabetes, hypertension, other immunological conditions. Such women also are considered in a high risk pregnancy group. In case of twin pregnancy, if it is not a singleton pregnancy, it could be twin pregnancy or a triplet pregnancy, any multiple pregnancy, there is a need for extra care for the mother and baby. So these risk factors, definitely they come under high risk pregnancy. So those who they get pregnant with history of recurrent pregnancy loss, all these medical disorders will make them come under high risk pregnancies. So these high risk pregnancies, if they are not taken care on time, it may cause risk to mothers and babies' health and life also. So whenever some ladies who are already having this medical or some issues even before pregnancy, it is advisable for them to go for a preconception counseling. If you are planning pregnancy, just meet your gynecologist so that you can plan a good pregnancy. If you are sure, check your sugar levels or any other ailments, whatever you are having. If you are getting tested them even prior getting pregnant and taking all prenatal vitamins, folic acid tablets, I think the risk can be a little bit reduced rather than suddenly getting pregnant and having an unplanned pregnancy and having issues. So few of the ladies, they have high risk factors, they get high risk during pregnancy, like diabetes and hypertension. In such issues, always it is better to get yourself checked with a good doctor in a tertiary care center where all facilities are available to take care of you and your baby. Thank you.